the next chairperson for our next session, Dr. BP Arneja, is a retired additional director of CGHS and HOD Pediatrics at Hedgever Hospital, New Delhi. Sir, please. Can we have a round of applause, please? Our co-chair will be Dr. Praveen Bhatia, Senior Physician and Director, Bhatia Hospital, New Delhi. So, our next speaker is from an organization which is very close to my heart, and I think even when I was a kid, I used to dream about that probably I'll be associated with them in some way or the other. And this conference has given me that opportunity that we have Dr. Ritu Rana from HelpAge India, which is a leading non-profit organization caring for disadvantaged elderly senior citizens for more than 3 or 4 decades. Its operations are not only urban but rural as well. Please give a big round of applause to Dr. Ritu Rana for gracing the occasion today. Thank you.
Before starting the session, good morning to all, and I will just convey a few words for Dr. Ritu Rana. She is the mission head of healthcare in HelpAge India. As Dr. O.P. Sharma told, they are doing very good job in the geriatrics, and she is working towards affordable and accessible and essential healthcare solutions for the marginalized population. This is really good. She is a trained medical doctor and a healthcare administrator with extensive experience of 2.5 decades, already 25 years, working on non-communicable diseases. Though her work with the Ministry of Health, and I'll say she has worked in all the departments of whether this is Ministry of Health and Family Welfare or the WHO or the developmental sector. She is an empaneled national trainer for elderly and palliative care at National Health System and Resource Center, and she is a certified integrated care for the older people, that is ICOP, from WHO. Now among us, she is the person who has represented in WHO as well as in the Ministry of Health. Dr. Ritu Rana.
Thank you so much for that introduction of me, and respected chairpersons, organizing committee of IAAMCON, participants, speakers, senior colleagues, friends. A very good morning. At the outset, I would like to thank the organizing committee for having this conference on elderly issues on the occasion of WHO Decade of Healthy Aging. And I would be especially thankful to Dr. Suresh Bansal, who has talked about HelpAge India, its work, and even taken some glimpses from the annual report of recent year 2023. I'm so thrilled to have that HelpAge India is known to everyone almost here, and I'm honored to represent HelpAge India here. Thank you so much. With that, I will start my presentation of today. So we have seen that how the aging population is going increasing, and what could be the medical diseases, or what could be the diseases they could be acquiring, and what could be the interventions. Here I'll talk something about what is healthy aging, and then what are the functionalities, how can we nurture our wellness. So what is healthy aging and what is wellness? Though I am sure that most of you know this, but as a part of this, I'll just try to look at what can be done. So as we see that aging, the trend of the aging is number and proportion of older people globally are increasing. So where it was around 12.3% in 2015, it will be 16.5% in 2030, and in 2050 it will be 21.5%. So this is global, but this is not, this is similar in India as well. If we talk about what is the elderly scenario in India, so today, as per 2021 population, it was not census, but it was done by the Ministry of Statistics. 60 plus population is around 14 crore. The old age dependency ratio is currently stands for 14%, and 71% of older population lives in rural areas. There is also the changing living environment. 20% households include people living in joint or extended families. 19% of them are divorced, separated, deserted, or live alone. So this is now what is the social and demographic status. If we talk about the health and care issues of elders in India, 75%, and this is the data from the last year's study and the recent paper which was published by Niti Aayog recently in February. 75% of elderly have one or more chronic diseases. 40% of them have one or more disability. 20% of the older population have mental health issues. 24% have assisted daily living limitations. 58 have difficulty in AIDL, which is institutionalized assisted daily living, and 11% have some form of impairment. 7% experience hospitalization and 60% receive OPD care. But only 18% of them are covered under any kind of health insurance, whether it is a private or the government or any kind of other. 25% face elder abuse, and often by their own kin. So this is from the HelpAge India's elder abuse report. And they are affected by loneliness and neglect. So this is the situation. Now what happens while we age? So while aging, you see the intrinsic capacity decreases. And the functional difference between the gap between the functional ability and intrinsic capacity, it increases. So when we are young, there is high and stable capacity. By the time the capacity declines, and when we age, as the age advances, there is a significant loss of capacity, and the difference, the gap between the functional ability and intrinsic capacity is increasing. So this is how it is. But we have been talking about healthy aging. So what is healthy aging? Healthy aging is something developing and maintaining functional ability. Whatever the functional ability was, can we maintain that while we are aging? That enables well-being of older ones. It is about creating environments and opportunities that enable people to be and to do what they value to do. Like whatever they would like to do in earlier days, are they able to do it now, whether it was a physical activity or it was a diet or it was taking care of their families or it was going to the work or something, are they able to do that? Being free of disease or infirmity is not a requirement of healthy aging, because many of us in the older age would be having one or more disease, but whether that disease is controlled, that is important. And the well-being takes about that control of the disease. It's not about that not having a disease, because with the age, it will come. We will have. But yes, every older person is different. Some would be looking like 80 years old while they are in 40 years of age, but some might be in their 70s but may look like at 50s. And we have seen that the extra years, the longevity is increasing. So we have now 20 plus years extra. So how do we like to live those 20 plus years? So there is some concept about wellness and healthy aging. I try to do some comparability of what is healthy aging and what is wellness. And then I found that while healthy aging is developing and maintaining the functional ability that enables well-being in older age, the similar thing is what we talk about the wellness, which is about interactive process of becoming aware of and practicing healthy choices. So if we talk about healthy aging and wellness, the terms are comparable. So healthy aging, here again I'll come back to that thing, that it will allow people to meet their basic needs. It is not the infirmity or absence of the disease, but it allows to meet their basic needs, learn, grow and make decisions, be mobile, build and maintain relationship, friends, what Dr. Bansal was saying, that it's important, and what Dr. O.P. Sharma has mentioned, that community support, friend circle, this is what is required when we age. And are we able to contribute to the society? So this is a wellness wheel which talks about, the wellness is about having the social, physical, psychological, intellectual, environmental and spiritual health. So the wellness is nothing about but having all those components together, and also having that capacity to maintain these, like having some kind of financial support to maintain and engage into the activities like that. So the changing trends, what we see now, whether like it's the longevity, it's feminization, it's like the diseases, non-communicable diseases, but yes, people have to engage into the physical activity, take the healthy diet. So what there should be a shift in attitudes towards aging, and that is what wellness comprises of, which is embracing a more active lifestyle, whether it is a gymming or whether it is a swimming or going walking, something, whatever is in your capacity. It's not that you have to strain yourself, but what is in your capacity, and you are able to do that, but regularly. Adopting healthier diets, of course, fruits, vegetables, that is all. Limiting yourself to alcohol and smoking, which is something very important. Prioritizing preventive health care. It's not only about the curative, but let's get into the preventive and the health promotive activities. Age-friendly houses, so having those handrails in your washrooms, in your walkways and everything, so that illumination should be proper. So these are something areas, and not only the houses, but whether the hospitals are having all those age-friendly, or the buses or the trains where we are commuting and through which we are commuting are age-friendly. Adopting technology wherever possible. So Dr. O.P. Sharma has mentioned some of the technology solution, but whether it is whatever the feasible and available, though some of them are not very available, affordable at the rural areas, but whatever limitations could be there could be a teleconsultation is happening, and some affordable devices. So this is where these things help in the wellness. So I will not take much on the talk right now, because we all know now the difference between the healthy aging, active aging, wellness, and how to comprise that. With that, I'll conclude my talk, and I'll be happy to take any further questions about HelpAge India, HelpAge India's work, or anything. Yes, sir.
Dr. Ritu, thank you very much for such a exhaustive, you have given good explanation. My question basically is, nowadays, as we are advancing into era of the artificial intelligence, more of digitalization, WhatsApp techniques, Wi-Fi, internet, but our elderly population is not being able to cope up with these things. So what is the solution, best possible solution? They sometimes feel depressed, just I'm not being able to do it. What I am doing in my patients is basically, I encourage the family to be on the WhatsApp, and what are the latest techniques are there. Don't let them feel depressed because of this. What is your opinion?
Thank you, sir. A very, very nice question. So here the solution, or could be a solution, what we do, and we encourage to have that support from the younger generation, support from the families, the granddaughters, sons and daughters, because maybe the son and daughter now they must be busy in their their working areas, but the children, the granddaughters, grandsons who have they could be very, very good supporter, and also the trainer of the people, older person, to on the WhatsApp or something, because the older population might not be very techno savvy on that, but they would learn, and there is an urge to learn. So if we take that intergenerational bonding, and this will allow to have that bonding also, maybe a few like I would say 30 minutes in a day, so that would help.
Just one more. How much? I don't know. I am having this. Might be having the other people this impression that HelpAge India is working in the urban area. How much you are contributing to the rural health?
So this is not true information, sir. So HelpAge India, I would say that 80% of work is in the rural and the remote area. So we work through, provide the primary health care through the mobile health unit, and these mobile health units are right now in 175 in number across the country, and the remotest location from Leh to down below Kerala, in the village areas where the health services are minimum. And that is where we are providing. We are also into providing that the capacity building and strengthening the community on the mental health of the elderly, and also something on the palliative care, training on them, providing the home care services to those areas. So 80% of work is in rural India. Thank you. Yes, sir. Yes, sir, please go on.
Ma'am, you just said in your lecture that only 18% of the people are covered by insurance.
Yes. Yes, sir.
And I believe that after 17, the insurance companies do not cover the people, elderly people, as far as insurance is concerned. The organizations like Help India should put pressure on Government of India to see that more people are covered under insurance, and the OPD treatment also should be included in as far as insurance is concerned. This will go a long way in mitigating the woes of the older people, you know. So this is my question, ma'am.
Thank you, sir. Yes, this is a very nice suggestion, and we will try to bring it to wherever we have that deliberation with the government and the task force.
May I intervene? Well, you talked about depression in elderly persons.
Sir.
So as far as depression is concerned, it just to supplement what you said, that it is at multiple levels.
Right.
But apart from the sentimental level, physical level is also very important. That you are physically incapacitated, that also contributes. So you have to be alert from before that changes in geriatric bones like osteoporosis, like osteoarthritis, maybe if you are a patient of lung disease, you do not land into COPD like situations. So these preventive measures will be a great help.
Thank you, sir. Yes.
See, I just wanted to add one point. So one thing is I wanted to say about the metabolic syndrome. This is one of the very important thing, because why I am saying so is about something, a new risk factor we must appreciate, all of us, is the sleep apnea syndrome. Now sleep apnea syndrome is going to be added to all the risk factors. And sleep apnea syndrome. Yeah. So this is one of the very important thing, and this can create, as far as the pattern of the sleep is concerned, so many proliferation. I like to be short. And second thing is, as far as the artificial intelligence, as far as the machine learning is concerned, or maybe pattern recognition is concerned, all these things is use it or lose it. That's my logo. Use the brain, continue using the brain, and definitely there are going to be ways to adopt it nicely. Thank you very much.
Excuse me, one more thing I would like to highlight, Dr. Rana.
Yeah.
Nowadays we are talking a lot, Dr. Anuja will, I think, agree with me. We are talking about the reversal of the age, like telomere concept is there. And what is your take on this basically? How much right it is ethically?
So I'm not a technical expert in that, but I would say that aging is inevitable, and we must grace the age as it goes, but how we keep ourselves active and healthy is something important to us.
Dr. Ritu, very nice lecture. I'd like to know the total structure all over India, how your HelpAge India is doing, because you said it is only 135 centers and they are catering to the rural. How about the other? And I think this is one platform in which we can request the government telling that they should have geriatric department in every hospital, because I don't think many hospitals have a geriatric department. So how you at this stage can promote, and this society can force government to go ahead with these geriatric departments, and HelpAge India to really tell us the plan, how you reach out the people.
Thank you, ma'am. So we are not only providing, so it's about 175 mobile health units, but other than that, because that is one part of the health interventions, we also have now. Firstly, I'll talking about HelpAge India, and then I'll talk about the next question. So we have old age homes also. So likewise, by HelpAge India we have 5 old age homes which are run by HelpAge India, 2 in Punjab, 1 in Leh also, 2 in Tamil Nadu. So this is how, and we also supporting one of the old age homes, which is the government run old age home, but we are implementing it in Patna, Bihar, and another one which is a widow home of UP government, which is in Vrindavan, which is also supported, and we are having a health intervention in that home for those widows. This is a very much like 1,000-bedded home in Vrindavan for the widows by Government of India. This is one part, but we are also supporting 400 old age homes which are not which are for the marginalized population, and free of cost old age homes. Supporting them technically and sometimes financially also across the country. We also work with the government of Ministry of Social Justice and Empowerment for implementing the helpline for elders, which is being run by HelpAge India in 8 of the states. We also have the physiotherapy units. So this is something about work we do. So it's not only limited to 175 mobile health unit, but we are trying to build in more and more in other areas as well. And as I said, that we also have that advocacy with the Government of India, and what the question you have raised. And luckily, I would be meeting Ministry of Health, and there is a program on National Program for Healthcare of Elderly by Ministry of Health. And on 16th, we have a meeting where they have invited us to support and to deliver on what else can be done at the PHC level, CHC level, district level. And I'll definitely deliberate on if I have something suggestions from your end, I'll deliberate that what services are required, whether it is a IC services or the human resources services at those level for the rural areas.
Thank you, ma'am. Thank you very much. And if there is any other question, that can be discussed over a cup of tea. Thank you very much.
Thank you so much.
I would also like our chairpersons to please wait. I would like Dr. Suresh Bansal to give them a green welcome. Thank you, chairpersons. And thank you, Dr. Ritu, for a really insightful talk about HelpAge India and your workings and how you project and see yourself to be the leaders in this field in the near future, and already are actually.